name is Yawara Kawano, and I'm the Associate Director of the Amyloidosis Center of Kumamoto University Hospital. I graduated at Kumamoto University School of Medicine in year 2006. And after my internal medicine training, I started to get involved in the plasma cell dyscrasia research from year 2009. After I worked in the US for a couple of years, I started to get involved in the Amyloidosis Center activities from year 2017. I have two major roles in the Amyloidosis Center. So the first one is to diagnose patients who may be AL amyloidosis. So we usually refer patients from other institutes who might be AL amyloidosis. So the first thing I do is to diagnose the patients by conducting bone marrow aspiration and also fat pad aspiration and skin biopsies. As a result, I usually send biopsy samples to the Amyloidosis Center core to diagnose the patient as AL amyloidosis. And the second important role is to treat patients who have been actually diagnosed as AL amyloidosis. So I'll be responsible for treating the patients with chemotherapy. I think that the multidisciplinary approach is very important for taking care of AL amyloidosis patients. And because since I'm a hematologist, I'm well trained for treating the patients using chemotherapy. However, AL amyloidosis patients have a lot of comorbidities, including cardiac amyloidosis and renal amyloidosis. Since our center has other staffs, including cardiologists, and also specialists who major in imaging, I can get support from those specialists when treating cardiac AL amyloidosis patients. Another major benefit is that when we are diagnosing patients, sometimes a certain patient can be difficult to differentially diagnose between AL amyloidosis or ATTR amyloidosis. So it is really important to involve other staffs, including the diagnostic core, since they are in charge of immunohistochemistry and also proteomics. We usually collaborate with other healthcare professionals using direct communication by phone or either using email. So as an example, I usually contact the diagnostic core using email. It's very quick because they always take a look at my messages. And also it's really important to describe in detail what the patient status is. And also sometimes when you're treating the patients, immediate contact is crucial because the patient might suffer from instant cardiac failure, etc., or arrhythmia. So in my opinion, a direct phone contact and email is very, very important on a day-to-day basis. The challenges that we face in our day-to-day work is that when we treat the patients, the patient condition changes dramatically, especially at the early stage of the treatment. So when we treat the patient with chemotherapy, sometimes the patient may experience cardiac failure or arrhythmia. So we need quick support from the cardiologist or the imaging core, including the nursing staff. So we need to combine all the information and we have to support the patient as quick as possible. And another point that is very important is that we need to diagnose the patient as early as possible, because sometimes the patient may have severe cardiac failure or severe nephrotic syndrome that may affect their lives. So we have to diagnose the patient with the correct amyloidosis in order to treat the patient with the correct therapy. So we need to contact the diagnostic core, and also to combine the clinical information to make the correct diagnosis. My message is to communicate with all the staff that is involved in supporting a certain patient. For instance, as I mentioned, the nursing staff, the pharmacist, the imaging staff, everyone who is involved in taking care of a single patient is really, really important. I myself is sort of a leader in taking care of AL amyloidosis patients, but each and every staff is very important. They have their own roles in taking care of a certain patient. So it is really, really important for everyone to collaborate and to cooperate